me Colleen Haggerty, who's our administrator of the immunization program, who will help me answer any specific technical questions you might have about vaccines. She's our expert. I'm here to speak in opposition of House Bill 361, which, as you heard, seeks to remove the department's authority to adopt rules to require certain immunizations for school and child care entry. As you probably know, immunization is one of the greatest public health achievements of the last century, and safe and effective immunizations have prevented millions of illnesses, disabilities, and deaths in the United States. But despite this success, vaccine-preventable diseases such as measles, mumps, and whooping cough continue to infect children each year, resulting in hospitalizations and deaths. We know that vaccine coverage is not 100%, nor are vaccines 100% effective, so outbreaks do occur when an unvaccinated person becomes infected and then goes into a communal setting like a school, especially those that have low vaccination rates. Fortunately, in New Hampshire, we consistently rank above many states with some of the highest vaccination rates, and this is attributed to the universal provision of vaccines to children at no cost in our state, as well as our school and child care entry requirements as well. Despite our high childhood vaccination rates, we've had over 2,000 cases of vaccine-preventable diseases and 5 outbreaks over the last 5 years in our state. Removing our ability to adopt rules and limiting which vaccines are required for school and child care entry would reduce our vaccination rates and also then increase the numbers of vaccine-preventable diseases and outbreaks. In terms of how this RSA currently works already, RSA 141C20 does give the department the authority to adopt rules. The rules that we adopt are HB361 under communicable diseases. Under this rule, children may be declared exempt from the requirements for medical or religious reasons already, but philosophical exemption or objection is not permissible in our state. Our medical and religious exemption is very low in New Hampshire. It's only about 1% or so, but there are some pockets in our state that have higher exemption rates, and we've also seen outbreaks occur in those settings as well. Our primary concern with the proposed legislation is that in order to make any changes to the list of vaccines that are required, we would have to come back and amend the actual statute and bring it back to the legislature. The way that we currently are adopting these rules is following the strict process that's required under the rulemaking statute. And so this already requires the department to seek stakeholder input. We have a process where we seek informal stakeholder input first, and then to try and address any issues at that time. And then after we seek the informal stakeholder input, we go ahead and do a public hearing. It's announced on our website as is required. And then we bring it to the Joint Legislative Committee on Administrative Rules, so it does come back around to the legislature through that committee as well. We've actually very infrequently made changes to the vaccine requirements for school and child care entry, with 8 years elapsing between the last changes. We just recently went through a rule change in November 2016. The last one had been back in June 2008. And actually no vaccines were added to school and child care entry during that time. So we have not added a vaccine requirement since 2008. The changes we made were really just minor adjustments relative to requirements for entry into certain grades. We received no objections to the proposed changes or to the existing requirements that were already in the rule. But while our changes are infrequent, it's really critical that the department have a flexible and nimble ability to change requirements through administrative rules so that we can more quickly protect the public's health in the event of a new public health threat or availability of a new vaccine. Currently, vaccination against 16 diseases are recommended. As you heard, they're recommended by the Advisory Committee on Immunization Practices, but not all of those vaccines recommended are actually required for school and child care entry. What we do is we review the childhood vaccine recommendations and then make proposals for what should be required for school entry, and then of course those do go out to stakeholder and public comment. Of the 16 recommended vaccines, 7 of those are listed explicitly in statute under RSA 141C20. And then we've added only 3 additional vaccines through rulemaking. 2 of those apply to children of school age, and all 3 of them apply to child care. There are also many recommended vaccines that are not required, such as for human papillomavirus or HPV vaccine, which you've probably heard about, meningococcal disease, pneumococcal disease, hepatitis A, rotavirus, and influenza. I wanted to talk about the 3 specific diseases that are not in the statute already, because if this legislation was successful, we would seek to add these to the statute. So the first one is varicella, or chickenpox, which has been considered by some historically to be a rite of childhood passage, but it actually can result in serious illness requiring hospitalization. About 1 in 1,000 infected children develop severe pneumonia or encephalitis, and 1 in 50 women infected with varicella during pregnancy will have children born with birth defects. So it's not just a nuisance disease, it's actually highly communicable, and it must be controlled to prevent outbreaks in communal settings such as schools. A single dose of varicella vaccine became a school and child care entry requirement in 2003, but after outbreaks continued to occur, they actually added a recommendation for a second dose, which we also implemented as a requirement for childcare. And when you actually look at our data in New Hampshire back in 2006, before we implemented the second dose requirement, we had 419 cases of chickenpox, including 1 death in our state, and then that's dropped to 75 just last year. So it's been very successful at reducing chickenpox in our communities. If this requirement were removed for school and childcare entry, we would expect to see an increased number of unvaccinated children being enrolled, and which would increase the risk for outbreaks and also increase, of course, the risk for children to be infected and have severe outcomes. The second one I want to talk to, which is also relevant to the next bill you're going to hear, is hepatitis B.
Let's stick to this bill right now.
Well, this is one of the ones that is not explicitly listed in statute. So I'm going to shorten what I say next time so that you only hear this once. Yep. So hepatitis B would also need to be added to the statute. It's a communicable virus transmitted through exposure to body fluids such as blood and saliva. It can remain infectious for at least 7 days on environmental surfaces and is transmissible even in the absence of visible blood. While rare, there have been outbreaks reported of hepatitis B in school and childcare settings. This has happened amongst sports teams when there's been injuries and blood in the contact with blood. It's also happened in childcare centers through biting. It's just a very common occurrence as well. So most people do recover from hepatitis B, but you can go on to develop chronic infection, liver cirrhosis, and cancer as well, so it can be severe. And of course, again, if you remove the entry requirement, we would expect to see the vaccination rates decline and the number of cases increase and putting kids at risk for actual outbreaks. And then the last disease I just wanted to touch on quickly is Haemophilus influenza, which is only required for only required for childcare entry because the risk is really for children under 5. It's also communicable bacteria, and it causes severe infections. In fact, it used to be the primary cause of bacterial meningitis. And they introduced the vaccine in 1985. Before its introduction, there were about 20,000 infections and 1,000 deaths each year in the U.S. There's one specific strain, type B, or they call it HB, that has been the primary concern, with about 1 in 200 children getting infected before they introduced the vaccine. And hearing impairment or other long-term neurologic damage occurs in about 15 to 30% of survivors, and 3 to 6% die despite appropriate antimicrobial therapy. So even if you treat them, they still have a high risk of dying. And recently there have actually been outbreaks in other states of this disease when we've had vaccine shortages, I think. And there were unfortunately deaths as well. Again, if you remove the requirement, we would expect to see an increase in diseases and potentially outbreaks. And then finally, the last thing I just want to mention is that if you remove our authority to adopt rules relative to this, it also removes a provision that allows for partial immunization relative to the age of the child. So under the current administrative rules, there's requirements that say that partial immunization is okay depending on the age of the child and what is actually recommended for that age of the child. If you remove our authority to adopt rules, then partial immunization wouldn't be allowable, and we'd actually have to exclude these children because they were not fully immunized. It also removes our authority to create the rules that will abolish provisions to allow for conditional enrollment. So right now, if a child comes to school at the beginning of the year and they're not fully immunized, they have a conditional enrollment period where they just have to show that they have an appointment scheduled to receive the vaccine, and then the child can still stay in school. Without the rules that allow us to do that, then the child would have to again be excluded. So removing these two provisions would result in more children being excluded due to incomplete immunization. We feel that the existing statute and corresponding administrative rules provide public health protection while appropriately balancing individual and parental choice with the goal of keeping children enrolled in school while protecting the health of all of the children in our community. And so I thank you for the opportunity to testify, and I'm happy to answer any questions you may
Thank
have.
you very much. Questions? Representative Messmer.
Thank you, Chairman. Does the passage of this, the passage of HB 361 affect the ability to provide free vaccinations?
Oh, thank you for bringing that up. So the issue around what we purchase versus what's required in school are completely separate issues. What we purchase all vaccines for all children in the state, so it can be provided at no cost, and it's actually a public-private partnership where the insurers pay into this. So it's not actually coming from state general funds, it's federal. It's a mix of federal funds. There are a small amount of general funds, but primarily federal and insurer funds. And so we have a vaccine association as well as a vaccine selection committee. So there are already processes in place that allow for physician, provider, stakeholder input into these processes. It's not secret, and it's also subject to right to know. So there are no secrets. Nobody's intentionally withholding information. And so what we provide for children in our state is just simply based on those 16 vaccines that are recommended by ACIP. What we are requiring for children for school entry is a totally separate issue.
Representative McCain.
Thank you, Mr. Chairman. I'm trying to get some clarification about rulemaking. It seems to be confusing. But in the House Bill 361, line 14 repeals rulemaking. Is it accurate to say that without specific authorization under 541A, you cannot issue rulemaking?
That's correct. You need to have authority within the statute in order to adopt formal rules that will bear the weight of a law.
So this eliminates that part of the statute entirely?
Correct.
Representative Kinnaird.
Yes, is it not true that under RSA 541.11, A11, you are required to hold at least one public hearing on rules? Hence, that renders the goal of Representative Frazier's bill totally moot.
That is correct, and when we went through our last rules process, we did hold a public comment period, and no comments were received for this particular provision. In fact, there were only 2 people who attended the public hearing, and they were supportive of what we were trying to accomplish.
No other questions? Thank you very much.
Go ahead.
Raise your hand, please.
Oh, I'm sorry.
Thank you.
I'm sorry.
I thought you did, but
I'm so small over here. I'm just curious. Since I no longer have children that need to go into the public school system, I'm curious about this from a parent's perspective. Are you aware of any children that DCYF may have removed from parental control as a result of a parent refusing to go along with the required vaccination list?
I am not aware of that. Are you aware of that?
No, I'm not aware.
I don't know if anyone at the department who would work in DCYF would be aware of those situations, but we haven't heard anecdotally of them.
thank you. Representative Kinnaird.
Do you, as the commission, feel that health decisions, or I should say medical decisions about appropriateness of treatment, should be made by the legislature or by the commissioner in consultation with physicians and the public, given that the second part also takes away the authority to discuss the child's age for administration or the number of doses, which are medical decisions? Do you think this is a decision that should be made by the legislature or by the commissioner?
I'm just going to step back and take that from a science standpoint. I think that the decision-making should be evidence-based. So to the extent that a legislature might be experts and have that science knowledge, I think it might be a challenge. Some of you may, I know, on this committee. I do think that it should be evidence-based practices that we're promoting from a public health standpoint. I do also think that there should be opportunity for public comment and also our legislatures comment as well. So.
Thank you. Representative Long.
Thank you, Mr. Chairman.
We're going to keep you here for a while.
The 7 listed vaccines, those are the 7 required to go to school.
So in the statute, there are 7, but through our thank you for the question, for the rulemaking authority, we've added 2 for school entry and an additional 1 also for childcare entry, so it's a total of 3 additional. So there are 9 for school entry and 10 for childcare entry of the 16 that are recommended.
Okay, and
Follow up.
Mr. Chairman. So if there was a new strain that you wanted a vaccine for, that you came up with an emergency situation, gel car would be quicker than the legislative process? Is that your belief?
Based on my experience, JL car would be quicker because we can bring rules forward at any time, except of course in the next 90 days, right? So, but normally you can bring those forward and they go through the process. So right now, if we wanted to add one for next school year, we could adopt rules, whereas it would be difficult and challenging at this point to change the statute. Usually you have to get in the 2-year cycle to bring forward legislation.
Thank you.
So passage of this bill, would it inhibit the ability of the state epidemiologists, once they identify an immediate threat, to be able to do much to move things along?
So there are different provisions in a truly declared public health emergency that we have pretty broad disease control authority in the department. In declared emergency, so it would require declared emergency, we might have more authority.
Who would declare that?
The process for declaring goes up through the commissioner to the governor. The governor
Thank you.
declares it.
Any other questions? Hearing none, we'll hear from more good folks who filled out pink cards and would like to hear. The first person I'd like to hear from is Larissa Texler. You asked for 3 minutes. Do you have written testimony? Other than one copy? Okay, fine, that's fine. Those of you who are sitting there waiting to talk, if you have written testimony, please give it to someone on either side of the aisle and they'll pass it around, hopefully before you speak. Thank you. Go ahead.
I'm Larissa Trexler. I'm a registered nurse. As a nurse, I am concerned about who and how vaccine requirements are imposed on children in New Hampshire. It is appropriate to have the legislature, rather than the Health and Human Services Commissioner, decide vaccine requirements. When the commissioner decides, it's a closed process, and that does not include an opportunity for me as a member of the medical community to weigh in with thoughts and expertise. It's the legislative process where this matter had originally been decided would allow for the inclusion of all interested parties, the medical professionals, the doctors, the HHS commissioner, and or his staff and parents, on whom these requirements would be imposed. As a nurse, I believe it would be proper to move daycare and school vaccine requirements back to the legislature. And as a nurse, I also have to say I find no reassurance in the testimony of the Health and Human Services. I urge the committee to vote ought to pass.
Thank you. Any questions of Mr. Trexler? Thank you very much.
I'm sorry.
Representative Edwards.
Thank you. So I'm confused. You weren't convinced by DHHS's testimony that there's an open process. They say there's an open process, you say it's closed, and so I don't know how to bring these two together. Could you explain a little bit why you believe it would be a closed instead of an open process?
Because here I am today, being able to discuss some of our vaccines, some of our laws that affect vaccines. I want that opportunity. I want the public, I want the citizens to have a say. And the medical professionals that want to be involved with myself, so.
Representative Pinner.
So you're basically stating that you think that the commissioner is in violation of HSA 541A whenever they make a rule, because that mandates an open hearing.
I don't know the.
I think we ought to stick to the body whether or not there should be a commission. I think that question is
It's
a
not.
little bit pointed.
I think my.
Takes away their authority.
Go ahead. Answer it if you care to. Feel
I
free
just
not
care
to
to
if you
say
don't care to.
that I'm a nurse and not a legislator. I'm a citizen, a parent, a nurse, and I perhaps have more to learn about that part of it. But I feel very strongly about this as not to pass.
Thank you.
Thank you for hearing me.
Eric Todd? Is it Eric? How much time do you need, Eric? You didn't put down.
I'll be
your-
brief.
Thank you very much, sir.
Thank
Appreciate
you, Mr.
it.
Chairman,
Welcome.
members of the committee. So I wanted to speak today about this because I know that I have friends who will support this sort of legislation. I actually do not. I oppose this for the reasons that have already been discussed, actually. I believe that the current process is functioning well. I see that we do have opportunities to provide public input, and I am satisfied with those opportunities. So I don't see that this legislation would have any net benefit for the state other than the opportunity for opponents of vaccination to have additional influence and to reduce the vaccination rates in the state, which I believe would be a negative for all of us.
Any other questions? Gentlemen, Mr. Todd? Representative Edwards?
Thank you, Mr. Chairman. Mr. Todd, from your perspective, if the state is paying, and these are free vaccinations, and if the state is providing the weight of its opinion to recommend some and to want to require others, why don't you think that the voluntary interest of the parents would take advantage of the free vaccinations and go ahead and vaccinate their children based on the recommendations alone without there being the force of law behind it?
So I believe that that would be the case in the majority. However, there will still be a significant minority of parents who, for whatever reasons, choose to perhaps believe the advice of internet blogs instead of the advice of the government or their physicians due to their preferences. And so again, I see that the only real result in the end that could come of this are fewer vaccinated children.
Thank you. Any other questions? Okay, I think now we'd like to hear from Matthew Black.
Platch,
Black.
that's me.
Pronounce it again, sir, so I get it right.
Platch.
Thank you, sir.
Okay.
And please fill out another card for the second bill. You filled out one card for both.
Yes.
We like to have a card for each of the bills. So with that, please proceed, and how much time you need, sir?
5 minutes.
That's a lot.
I'll be brief.
Thank you.
I'm a citizen of New Hampshire. I live in Wolfboro. I'm an attorney. I've been practicing for 30 years. Most of that time I've spent representing large companies, pharmaceutical companies, chemical companies, telecom companies. And what I've done for 30 years, and to put it bluntly, is I convince government regulators and administrative agencies to do what I want them to do in my client's interest. It's an art form, it doesn't sound that nice, but it's legal and it's what I've done. So I know how these administrative agencies work and I know how it gets through the rulemaking. And you'll see today, just this bill has gotten all these citizens here. And what we heard in the testimony was the last time there was a hearing by the administrative agency, 2 people showed up. So, yeah, there is a chance for input, but it doesn't really happen the way it's anticipated in the statute, in the Administrative Procedure Act. What we have here is a forum with elected officials making a decision. They've made this decision to put numerous vaccines into the statute and require it in the statute, and it's working. The bill today, all it says is that the commissioner can no longer add vaccines to the schedule by administrative rule. Doesn't take away our rulemaking authority for vaccines already on the schedule, already in the statute. At least that's how I read the bill. And I haven't seen the revised version if there is one. So we're taking away authority. The proposal is to take authority away from the commissioner to add vaccines to the schedule that the legislature hasn't seen fit to put in the schedule. That's all. And it makes sense because the legislature is elected. The commissioner is not. The staff at the commission are not. They can have a public hearing and ignore what they're told or say, we weren't convinced. We're gonna go this way instead. And they don't have to answer to the citizens. In the meantime, they're telling the citizens of the state that they have to purchase a vaccine. Yes, the state pays for it, but the taxpayers pay the state. And they have to inject that vaccine into their children. And the one thing they didn't say today is that there are side effects of the vaccination. Bad things can happen to some children because of the vaccine. That's why the pharmaceutical companies threatened to stop making vaccines back in 1986. We said, we cannot make a one-size-fits-all vaccine that's safe for everybody. Some children are going to take it on the chin for the rest of us. So Congress granted exemption from any liability. They set up a court that if you're injured, you can file a claim and get compensated by the U.S. government in that court. And this all happened in 1986, the law changed, took effect in 1987. The idea being that some children will get hurt because of these vaccines. And if we're going to be hurting children in this state, putting some children at risk, even for the good of all the public, the legislature should do it. It shouldn't just be done by administrative field. I'm happy to take questions.
Thank you very much. Questions? Yes, Representative Messmer.
There is a medical exemption path, and there's also a religious exemption path, correct?
Correct.
So we wouldn't necessarily be putting people in harm if they had some sort of medical issue that precluded them their ability to have the vaccines. Is that correct?
If that medical issue is known in advance, and if a doctor will sign a script and make that recommendation. We could talk about what happens to the doctors that do that. There is a lobby out there. There are pressure points if doctors signing a lot of those scripts. And I don't know how often that happens. I do know that there are religious exemptions.
Thank you very much. No other questions? We'll hear from Abby Rogers. How much time do you need, Ms. Rogers? And are you in favor of or do you oppose the bill? You oppose the bill?
Yes, probably a minute. Maybe.
Thank you.
Thank you so much for letting me speak on this bill today. My name is Abby Rogers. I'm the Director of Advocacy and Government Relations for the March of Dimes Northeast. And we are in opposition of House Bill 361 today. The suggested repeal of the section C6, 13 through 16 is concerning to us. We feel the action would significantly weaken the authority of the Commissioner in relation to vaccines and communicable disease prevention. Vaccines are highly effective means of preventing infectious diseases. Federal and professional guidelines recommend childhood and adolescent immunizations to protect against a wide range of viral and bacterial infections which can lead to disability and death. My organization's foundation that supports our mission is to prevent preterm birth, infant mortality, and birth defects. And we are, as opposed to this, we think vaccinations are extremely important for good public health. Thank you.
Questions? Hearing none, we'll hear now from Jack Schmidt.
Yeah, my name is Jack Schmidt.
Schmidt. Thank you. From
From
Freedom, New Hampshire?
What's that?
From Freedom?
No, from Ware, New Hampshire.
How was your ride in?
Well, that's why it took me a while to get here. I had to do a lot of snowboarding.
Well, welcome anyway. Thanks for coming.
No, I actually am from Ware, New Hampshire. The organization I represent is Health Freedom, New Hampshire.
Okay, Health Freedom. And you're in favor or you're opposed to the bill?
I'm in favor of the bill. The Health Freedom New Hampshire organization represents over 300 parents, professionals in the healthcare field who are in favor in all cases of freedom of choice, our New Hampshire advantage, live free or die, the ability to choose our medical treatments. One of the previous speakers mentioned vaccine injury. vaccine injury is no longer a controversial subject, although some people will continue to bring it up. The Supreme Court has already stated that vaccines are unavoidably unsafe. And in the National Childhood Vaccine Injury Act of 1986 from Congress, they gave the pharmaceutical industry a liability waiver. They put a tax on vaccines, so the money from that would go into a pool, and then they shuttled all the cases into a special court. Most people call it vaccine court, but it's actually a federal court of special claims, and the cases are heard before a special master. There's already been over $3 billion worth of awards paid out when this very difficult process for people has found that the patient has been vaccine injured. But on top of that, there's tens of thousands of people who didn't know this court existed, and they lost their 3-year statute of limitations time to bring their case forward. So it's been estimated that there's going to be over $1 trillion of liability due to vaccine injury, even though they're essentially trying to keep that quiet, or the pharmaceutical companies have a massive propaganda effort, well, let's call it public relations, to cover that up. On top of that, and I'm bringing this back around to New Hampshire and why you should be aware of this, that is, this is going to come home to roost here in New Hampshire at some point, and there will be massive awards for the vaccine injuries. Now, I'm not actually anti-vax. I'm for vaccine safety and scientific integrity and vaccine effectiveness. What happens is most public health agencies get their information from the Centers for Disease Control and Prevention in Atlanta. However, and now I'm going to name drop, but it's all over the news. You'll see it sooner or later. Robert F. Kennedy Jr., essentially in his testimony to the Vermont legislature last May, essentially says that the CDC is a broken agency. It's been captured by the pharmaceutical companies. Some of the evidence of that is that there are whistleblowers within the CDC. The most famous one is Dr. William Thompson. He's provided, I think it's over 100,000 pages of documents in regards to the study that's always been used to demonstrate that MMR does not cause autism. He delivered those to Representative Posey of Florida, who's spoken on the House floor. He's trying to subpoena this whistleblower to testify about what happened within the CDC. The CDC, in this 5-scientist group, actually destroyed records when the records showed opposite of what they wanted to find. So their scientific results actually showed that the MMR causes autism. They actually were able to label which types of cases. Now, why does this come back to
Can
me?
I stop you for a minute? Are you opposed to vaccines in general?
No, I'm not.
Thank you.
Okay. What happens is there apparently is an effort to indicate that vaccines that are hardly effective, for example, flu vaccine, which is approximately 3% effective, must be taken by everyone. And I'd be glad to provide more documentation of that, but it's not actually pertinent to this bill. So in the case of all the whistleblowers, there's a CDC scientist that has taken the case to the federal court in Utah as a whistleblower. There's an anonymous group of 12 scientists called the CDC Spider, which is the Scientists for Professional
Can we
Integrity.
roll this back to the commissioner? And
Okay.
his authority the department's authority to operate through rules rather than
I believe it gets to the issue of
a litany
accountability.
that is giving us a history. We don't need that. We need to know what your position is on the commissioner and the department's ability to issue rules, to operate through rules. That's what we're focusing on.
Sorry, there was other testimony given that vaccines are effective and non-injurious, so I just
Thank
wanted
you.
to counter that. The issues will come to roost in most likely legal cases. As you know, the new president has put that on his short list of 10 items to cover, in the first week. He may cover it tomorrow for all we know if the speed he's going. Vaccine injury and scientific integrity. So, as a previous person testified, apparently nobody knows about the hearings at the HHS. On top of that, I know that people have made requests for information, and those requests have gone unanswered after months and months and months. I think someone's going to testify to that effect after me. It may not be secret, but that has all the appearances of secrecy, and we want issues like this to be out in the light because, believe me, they will appear in the courtrooms here. They're already appearing in the federal courts all over the country, in the special claims court. There's going to be tremendous liability. I don't know exactly who would have to pay it here in New Hampshire. So, as a person advocating for health freedom, one of the important things about freedom is the transparency, the ability to know this information, the ability to talk to people who can affect it, change laws. And I guess that's why I would follow this, I would favor this bill.
Thank you very much for coming in and enlightening us with your feelings and position on the bill. Any questions for the gentleman? Hearing none, thank you very much, sir. Okay, two more speakers. Laura Condon, and you asked for 5 minutes. Please keep it as low as you can. Don't repeat things that others have already said.
I won't.
Thank you.
I understand how important it is to include everybody and be speedy and not redundant. My name is Laura Condon. I'm a resident of Bedford, New Hampshire, and I do appreciate the opportunity to speak before you today. I am a volunteer advocate with the National Vaccine Information Center. It's a national nonprofit. It's an educational resource and advocacy organization, and I've provided each of you with a booklet that we've produced. It will be a resource for you on vaccine policy. I also serve on the board of directors of the New Hampshire Vaccine Association. That is the purchase entity, the funding entity in the state. But I must make clear that the New Hampshire Vaccine Association takes no position on this matter, and I do not represent any position of the board, but rather I am here for personal testimony. However, as member of that board, I am informed and knowledgeable on matters of vaccine purchase, availability, and costs. I do come today to ask you to support this bill and give it an ought to pass vote. Current law requires children to be vaccinated against certain listed diseases, as we've heard, and thereafter grants authority to the Commissioner to adopt rules and the rules process for any other vaccinations that shall be required. This is problematic in that this is a risk-borne medical mandate imposed on the children of New Hampshire without the opportunity for the public to provide input that may meaningfully influence any vaccine requirement decisions. And I'm very familiar with the rules process. I've been to their hearings that the department holds. I've been before JELCAR. And I've also been here in committees before the legislature and do recognize the difference between one is a very closed process and one is a much more open process. Once the authority is granted to the commissioner, there are no vaccines that he would not be prohibited from imposing on requirements if they have been recommended by the Advisory Committee of Immunization Practices of the CDC and certain medical trade groups. There's no way that we can prevent any of his proposed rules from being adopted because we've granted him authority in this current statute, and that's what that seeks to change. So it's going from a closed process to an open process. The rules, as I say, go through JELCAR, and absent a conflict with state law, as you may know if you've sat on JELCAR, there's no way to prevent those rules from being adopted. So once the authority has been handed over, it is assured that those rules will go through. He has, here, trying to move ahead. And there's nothing, the growing concern is, as you will see, I provided you with a handout of vaccines that are required for New Hampshire's children. It's a 2-page document, so you can see there is a difference there. And there is, depending upon the age of the child, it might be 9 to 10 different vaccines, but that would be anywhere from 29 to 35 doses. So it's a lot of shots. Whereas this is the CDC schedule, it's much more expensive and many more vaccines. The rules process does not prevent all of these from being mandated for New Hampshire school children. The legislative process with public hearings like we have here today, we've got representatives and senators representing their constituents' interests rather than the interest of a federal agency. And this is an open, inclusive process, which of course also welcomes the views of the commissioner. doctors, other medical professionals are welcome to testify at these public hearings. So in no way are we excluding, and we've heard representatives of the department speak here today, so in no way are they excluded from this open process. And let me assure everybody here that repealing the authority of the commissioner would not repeal any existing vaccine requirements. Those rules will stand until they expire. It would, however, allow future vaccine requirements to be decided more appropriately by the legislature. And it was talked to before about the closed process here. On August 3rd, I was the individual who made a right to know request to the department. I wanted to know how and who determines what daycare and school vaccine requirements are, and how and who selects and determines what type and brand of vaccines are purchased by the state. I was seeking specific information, how these committees were formed, who sits on them, are they appointed individuals, what are their terms of service, when are the meetings held? I'd like to attend a meeting. Is there meeting minutes, notes, anything I can refer to? And that was a request that I made August 3rd. I've made 5 follow-up requests, and I've yet to be provided that information. What I was provided was a vaccine policy, vaccine selection policy guide that the department has adopted, and that doesn't refer to what vaccines are required for school children. This refers really to which vaccines does the state decide they want to purchase. So, so I really didn't get answered on how is it decided which ones are going to be required. And the committees that sit on these, I do know how they are made up. It's detailed in the policy, but there's no disclosure of who those individuals are, and there's no public members on those committees, none whatsoever. Final page here. So there was, like I said, I'm familiar with the JLCAR process. It's a closed process. The department puts forth rules from time to time relative to vaccine requirements based on recommendations of the CDC. Again, this is a CDC schedule. There is growing awareness and concern with parents that they have no input into this vaccine requirement process or decision. It would be appropriate to move these important medical mandates from a closed process to an open process, and I ask that you consider it appropriate for daycare and school vaccine requirements to be decided through the legislative process rather than through the commissioner. And a point to be made, that someone asked about the amendment here, and I don't think it was quite clear. The amendment will allow for partial immunization relative to the age of the child, and it stops there on line 11, if you'll see on the bill, and it stops there, such that it is only deleting the part as specified in rules adopted by the commissioner. So partial immunization relative to the age of the child still will be permitted if you adopt that amendment.
Thank you very much, Ms. Condon. I appreciate your coming here. We see you from time to time.
Yes,
You're always
yes.
welcome.
And I'm happy to answer any questions.
There is a question. I believe I saw Representative Edwards.
Thank you, Mr. Chairman. So Ms. Condon, I'm just curious what your thought is. You're saying that there's really no way to provide oversight to this rulemaking process by the public, but I'm curious why you think that if the legislature were to have a bill striking vaccination J from the DHHS recommended list, that would effectively give some oversight to the legislature to act in those cases where the public comes to the legislature saying there's a problem. What do you think about that as a relief valve or a safety valve to what you perceive to be too closed a rule-making window?
Great question. That will be House Bill 362, which I believe this committee is hearing next. And I guess we'll see how well that process works there. That is seeking to strike vaccines that target diseases that are not
We're
communicable
going
in
to
a
hear
classroom.
testimony at 362 that will answer his question.
Well, that pretty much does. I mean, if that bill doesn't pass, that pretty much answers your question. Kind of shuts down the process.
I'm sorry.
Okay,
Let's not argue with it.
It's a
It's a great
follow-up.
question.
sure.
But couldn't today, right now, if one of these diseases that are currently in law, we want to strike in an amendment, in just a single stroke, that could go before the legislature as well. So there is a review process. There is a way for the legislature to fix any of this. Why would that be inadequate to meet your concerns?
Because I think it's harder to strike down a vaccine requirement than put forth a vaccine requirement based on good medical and scientific testimony about what a vaccine does or doesn't do.
Thank you very much. Any other questions? Yes, Representative.
Have you tried the,
Question?
do you have trouble, yeah, thank you. In getting information from Health and Human Services, I assume you think they're botching everything. And the Freedom of Information Act, you can't go in there and get the information that you want?
Well, I did put in a right-to-know request to the appropriate individual, and she did acknowledge my email. She did acknowledge it was a right-to-know request and said she would be responsive to my request. She did forward me this vaccine selection policy. I did follow up with her with numerous emails since August 3rd, reminding her that I had not had all of the information I requested disclosed, and I'm no longer getting a response.
Thank you. We're getting within, right near the end. We've got one card left, and I want to make sure that person has time to speak. Any other questions? Representative?
Thank you, Mr.
Guthrie.
Chairman. Just a quick question. Thank you for your testimony. Are we concerned more with the process or the result of the process? Is the result of the process that's now in place giving us and giving the decision-making people bad information? Is that what we're concerned about? And that because of that the decision, the commissioner does not have all the facts before him when he makes that determination, or the process makes that determination?
I think the answer is both. We're concerned about both of those, the process and the results. And I have gone to those hearings on rulemaking. I have testified before JELCAR, and it's been, here we're discussing the merits of this bill, the pros and the cons, the benefits and the drawbacks of it. That is not testimony that JELCAR is interested in hearing. What JELCAR is interested in hearing, the commissioner's been given the authority, is he overstepping his authority? Period. If he's been granted the authority, there's no room for debate on the merits of the vaccines that he's proposing. No opportunity for that, because he's been granted the authority. He already has it. So it's the process. It is closed. And as we heard from the department earlier today, there were 2 people who showed up at that JELCAR hearing, whereas we've got a good number of concerned residents here today. It is a much more open process. And in the end, we have seen vaccines being mandated that we do not believe are appropriate for school children.
Thank you.
Thank you, Mr.
I think we have it. The last speaker,
Thank you very much.
thank you for coming. The last speaker is Jenna, and thanks for your patience. Fidel? Did I correctly say your name?
Fidoni, but that's
Fidoni,
close enough.
okay, good. Good,
And thank you so much, committee,
And
for
keep it as short as you can,
Yeah.
please. We're running behind schedule.
the opportunity to speak today. My name is Jenna Pedoni. I'm a resident of Manchester. I'm also a registered pharmacist in New Hampshire. I'm here to speak in favor of the bill. Because vaccines can cause harm and are unavoidably unsafe, as per the Supreme Court, parents should have the right to come and speak with an open forum like this and not just have the commissioner make comments on that, with the right to choose to vaccinate or not. As a pharmacist with 5 years of schooling, we spent really all we learned was vaccines. You never learned what was in them. You never learned, are they effective? And so you just learned, this is the CDC schedule. This is the same dose. Everybody gets the same exact amount. As a pharmacist or a nurse or a doctor, no other medical, no other drug or anything you'd never give the exact same thing to everybody. Why do we do that with vaccines? Well, because there's huge money in it. And because of the bill that someone mentioned earlier in 1986, You cannot sue a drug manufacturer, you cannot sue the doctor. So if your child is harmed, if you are harmed as an adult, which we're seeing astronomically with the flu shot, the H1N1, all that, you have no recourse. So to have a commission where it's just one commissioner saying this is what we're doing for vaccine policy, that is so horrible for the citizens. You know, every child should be able to, parents should be able to say, I want this vaccine, I don't want that one, I want to study the ingredients, and I want to decide. Maybe my child can't handle certain vaccines or has autoimmune issues where they can't clear it. So that we should be allowed to not give the same dose to everybody. As far as physicians, also one thing I never learned in school, physicians get a kicker bonus. That could be up to several $100,000 a year to keep your child on schedule. So they're not concerned with you being allowed to have a say of, I want this one and I don't want that one. They're going to bully you and pressure you to get the whole schedule for the bonus. So with that being said, I actually just got a text from a friend whose child died of cancer, brain cancer yesterday, a 6-year-old. There's such a strong correlation between making these kids get these vaccines when they enter school, and then things like childhood diseases like leukemia and brain cancers. So I would strongly request that the committee to pass this bill and allow parents and the legislature to have the right to discuss these and not just have it be the commission.
Thank you very much.
Thank you for your time.
Close the hearing on House Bill 361. We're going to break for 5 minutes. Want everybody back here in 5 minutes. It's been a long hearing. Give you a chance to walk around a little bit, loosen up.